Hi there. It's been a little bit since I've made a video and I have a couple minutes, so I wanted to make this video to kind of go over a couple things, what's been going on lately with my health and everything. So if you hear the dishwasher is running in the background, so if you hear like a water noise, that's what that is. So let's see. I started and finished occupational therapy for lymphedema, and I have very mild lymphedema, and that's like a retention of fluid, and that's because, you know, of the radiation and the surgeries and removing of lymph nodes. And so very mild. She was not very concerned, and I was like considered in like the normal range. But for like six to 8 weeks, I went just once a week for about an hour to an occupational therapist who specializes in lymphedema, and got treatment. And they did a lot of interesting things, a lot of like I don't know, like cupping, which is like this machine that does like reverse pressure or reverse suction to kind of move fluid, and learn some massaging techniques to like kind of empty out my lymphatic system, and did a tiny bit of stretching and strength training, which like towards the end we kind of realized that's what I was benefiting from most. And so after talking with her, we decided to switch to a physical therapist and kind of work on strength and range of motion stuff. And so now I'm seeing a physical therapist 3 times a week, and I've seen huge improvements in just the last couple of weeks. Before, my right side, I can lift my arm up normal. My left side, I was kind of like doing this a lot, but now I can like lift it up pretty good. Not all the way still. Reaching behind my back is hard. I can't reach my hand up very high on my bad side. My rotator cuff was off, and it's just because of lack of use and because of all the surgeries, and I was babying it and then not using it, and then it got weaker, and then all my muscles constricted. And so anyways, I'm seeing huge improvements by seeing the physical therapists. I do my appointments at 6:30 in the morning, so it's like first thing in the morning, but it's only 5 to 8 minutes away from my house, which is nice. And I chose that time because it just kind of works good with, I don't have to worry about childcare and things like that. So that's going good. He called me a legend and said he can't believe how much improvement he's seen so far, and it shouldn't, maybe just a couple more weeks, and then he thinks I'll be good just to continue on my own. And you know, the goal is to get me all back to completely normal, back to 100% functioning, because I am going to have another surgery. And that brings me to the next topic. So this afternoon I had a meeting with a plastic surgeon, and this is the same plastic surgeon that did my first reconstruction in my first surgery. And so we talked about options and timelines, and kind of took a look at everything to kind of see what's his recommendation. And so basically I only have one option, and I don't know if I am like flattered or let down that I don't have the second option. And I don't have the second option because I don't have enough like fat, like belly skin. So one of the options was actually removing belly tissue, like fat tissue from your lower abdomen, and then like creating breasts with them. And so it is a huge surgery, a big recovery, but it's kind of like you put it's a long surgery. It's like 8 to 12 hours. You put a lot of effort up front with the long surgery and recovery, but then you basically, it's your own natural tissue. You don't have to do any maybe adjustments, but you don't have to do any big surgeries later. But I am not a candidate for that. He thinks that I just don't have enough tissue, like I said, to do that. And so I was kind of almost relieved, because that just kind of sounds scary, but I was leaning towards that. So at the same time, I don't know if I'm let down. So what we probably are going to do, unless something changes, is do reconstruction, because I'm also getting my right side, my right breast removed, a mastectomy, a prophylactic mastectomy. What we're going to do is a reconstruction with implants. I'm not crazy about implants because I had that one before for a couple months, because it just was a little uncomfortable, but that's kind of my only option besides staying flat at this point. So, but what they do have to do, because my left side I don't have a lot of tissue, is they're gonna remove like a football shaped piece of skin and fat and a little bit of muscle and like blood vessels and everything from like back here and this muscle, and then they're gonna use it to create a pocket on my left side for the implant. And then on the right side, they won't have to do anything crazy major. It will just be an implant. And they are gonna do the type of implant where it's like, it's called expanders, where first it's like a bag, and it like, you like get it filled over the course of 3 months to fill it fuller. And then once you get to the desired look, feel of all that, and the skin has like had time to expand, then you get the fillers removed and you get like implants put in. That's another surgery. So it's a little more work. He said it's gonna be a little bit tougher on my left side because I have no tissue left because of the 2 surgeries, and like it's been radiated. That's why we're gonna use that extra skin. And implants don't last forever. That's why I kind of like the other option, because implants like last, you know, 10 to 15 years or less. And so like in 10, 15 years, I'm either gonna have another surgery to get new implants if I'm having problems, or, you know, a lot of women just choose not to, just to be flat. And I don't know, I might have that option, but right now I'm not leaning towards that way. I would like breasts, and I don't wanna have to deal with prosthetics anymore. That's not fun. And so I just wanna look normal in a shirt. So, and don't have to deal with prosthetics anymore. So that's kind of the update. So still a lot of appointments, but honestly right now I'm just doing the physical therapy, and it doesn't really feel as like medical. I'm not going to U of M for my physical therapy. I'm going to a local place, and my insurance is covering it and everything still, but it just kind of feels like, I don't know, like it just feels different than like all medical in the cancer world. So I even though I'm going 3 times a week to an appointment, it's super early in the morning and it doesn't really feel like I'm doing too much. But that will end soon. Oh, other than that, I didn't do an update on here, but we did have another scare on my MRI in January. When did I have an MRI? Oh, I don't know, March. I had an MRI in March, and it was just because I hadn't had one in a while, or ever actually. Something popped up on my left chest wall, and then it was like, what is it? We gotta figure out what it is. Could it be cancer? So then I had an ultrasound and they couldn't find it. So then I had a CT and they couldn't find it. So then you're like, okay, well now it's resolved, so it probably was nothing. But let's do another check in 6 months. So my doctor's not worried. You know, sometimes things like just pop up. MRIs are very sensitive. They couldn't find it. You know, whatever it is, it's again, just like that one CT we had. It's in a different area on my chest. And so it's not the little thing that popped up on my CT in November. It was something new, but it's gone now. It's resolved. So most likely nothing, but they're gonna check that out again. And I think in September will be my next MRI. Yes. I also had a mammogram and that was clear, so that was good. Yeah, so that's kind of what's going on. Things are moving, things are happening. I really am feeling so strong. Paul and I are getting ready to go at the end of this month on a big vacation. We're calling it our True Love Adventure, and we're flying into Las Vegas and going to the Grand Canyon and Zion and Bryson Canyon and like all the national parks over there for a whole week. We're leaving our babies at home, and so we're very excited for that. Other than that, God's been good. Been busy at church, doing ministries, and taking care of the kids. That's what I've been doing. So thank you everyone for praying, and continue to pray that, you know, as we look at these choices for the next reconstruction surgery, that, you know, we kind of have the right mindset and that we can everything can go smoothly with what ends up happening. So, okay, thank you. Bye.